Hi, everyone. Welcome to this insightful question and answer session with Dr. Akshay Kumarswamy, a globally renowned periodontist, implantologist, and educator with over 2 decades of experience across India and the United States. As a diplomat of American Board of Periodontology and a respected academic mentor, Dr. Kumarswamy brings a unique blend of clinical expertise and teaching excellence. In this series, Dr. Kumarswamy addresses a common questions from dental students and young professionals about choosing MDS in periodontology. From developing surgical confidence and understanding the curriculum to navigating college choices, fellowships, and building a standout career in periodontics. Whether you're considering periodontology or already on the path, these conversations are packed with a clarity, encouragement, and a real world insights. So let's dive in. Welcome to the platform, Dentowesome, sir.
Thank you. Thank you for having me, Nisha. Pleasure being here.
So, my first question to you is what first ignited your passion for periodontology? Was there a particular clinical case or a mentor that inspired you to pursue MDS in periodontology?
So before I answer this question, let me go a little bit into my educational background. I happened to do my BDS from COTS Davangere in Karnataka. Immediately following my internship, I went to the US and pursued an advanced education in general dentistry, which is like a 1 year training in general dentistry. And this was at Boston University. And once I finished that, I was trying to figure out as to what I should be doing. And I was very interested in prosthodontics as a subject, but I also had the surgical skills that, could take me into either oral surgery or periodontics, as I knew those were the only two specialities which had some kind of surgeries in them. So on and off, I kept thinking about that, and I did apply to a few prosto programs and a few perio programs. Now, in fact, I'll let you know what changed my mind from prosto instead of telling you what got me into perio. So I had a few friends who were prosto PGs at Boston University when I was doing that 1 year fellowship. And I used to see this, we used to leave school at about, let's say, 8 o'clock, 9 o'clock after doing all our lab work, which we were supposed to do ourselves. When we were leaving, I could see the prosto PGs come in, which meant they actually used to start doing their lab work. They used to go home, have dinner, come back, and then start doing lab work for their next day's patients. And some of them stayed there until almost about 2 o'clock in the early morning. So that is when I decided that, this is not something that I'm cut out for. So let me start thinking about the surgical aspect of dentistry. Now, oral surgery in the US is a 6 year program. So I was not willing to put in 6 years of my life into trying to get a master's in oral surgery. So then I thought about perio. Now, a bit more background about this is the fact that my father is a periodontist. So he had been practicing in Mumbai for the past 45 years now. So we have a practice here, which I have joined eventually. So I had, of course, seen him do perio surgeries and stuff. But again, was I keenly interested? Probably not. I think what got my interest is when I went into Boston University and saw the PGs there do perform surgeries. Because as a general dentistry fellowship candidate in that 1 year AGD, we had to help observe those perio PGs do surgery. So you are sitting on the assistant chair and observing them do it. So I think that kind of evoked my interest, and I started applying to a few perio programs as well, and then was lucky enough to be accepted into the University of North Carolina at Chapel Hill, which is one of the top institutions in the world, and did my perio MS from there. So again, I know that your main audience would be somebody who wants to pursue the master's in periodontics either in India or abroad. So I'm glad that I'll be giving a broader overview about the entire topic. So yeah, I mean, if you think about that, probably a few clinical cases of crown lengthening that I saw while assisting the perio PGs got me interested. And as far as a mentor in periodontics, as I can probably, I think having my father being there as a mentor in the subject certainly helped.
So, there are some students who say that I'm not confident in my surgical skills during BDS. So can I still choose periodontics? And how much of the BDS experience carries over into the perio department?
Very good question. So if you think about it, the word skill is something that is gained over time. Nobody is born, blessed with surgical skills. So this is something that all of us, and which is why dentistry is called a practice. I mean, you keep practicing day in and day out, you keep doing procedures, and you get better at it. So yes, certainly, even if one of the students is not confident in the surgical skills, it is something that can be honed over time. So again, that is the reason why an MDS is there, where you can hone your surgical skills. If someone is taking a break between BDS and MDS, the one way of getting better at surgical skills in terms of periodontics would be in extractions. Try and do as many extractions as possible. While doing extractions, try to reflect flaps, get the teeth out, try to close the flap again, give some sutures. So all of those are surgical skills that can be honed over time. Even if you're not in an MDS perio program, you can do it before entering the program. So as far as skills are concerned, again, as I said, nothing to worry about. You can always hone your skills once you start the program. And if somebody is not in the program yet, they can do via the extraction route. So, and again, when you talk about BDS experience, carrying it into perio, see, one of the main things that we do as periodontists is try to save teeth. And when we try to save teeth, we are trying to do that by ensuring the patient has a good foundation of their gingiva. The gingiva and bone, when it has a good foundation, prolongs the life of the tooth. So a good way of training your surgical, I would not say surgical skills, but your training in perio would be to learn a good scaling and root planing. How to do scaling and root planing very well at your BDS level will certainly help in navigating that aspect when you come into MDS. Because when you do a periodontal surgery, you raise a flap, the next step becomes how you scale and root plane. So when you know that skill, it certainly helps in the next level.
So, what does the MDS periodontology curriculum truly involve? What can we expect to learn in the first year, second year, and third year, sir? Can you please guide us?
So sure. So this is something that differs a little from things that are taught in India versus what I was trained in the US. Now, I'll give you first the US perspective and then come into the Indian perspective. In the US, there was no hard and fast rule as to you have to do this in the first year, you have to do this in the whatever case came in, we could do it with the help of seniors or the faculty. So I did a sinus lift in my first year. I mean, that is something that is unheard of here when you're doing MDS perio. But I was thrown into the deep end. I mean, this is something that I could do, and I had to call my mentors in, call my faculty. A senior third year resident would sit on the assistant side and teach me as well. So there was a lot of good mentorship, not just from the faculty, but from the senior residents as well. So we had no limitations on what we could do. I have done from a simple scaling and root planing all the way up till a sinus lift and full mouth implant placements as well. So coming to the Indian perspective, I know that there are curriculum laid down by the DCI, I believe, where you're supposed to do some things in the first year, some things in the second year and third year. From what I believe, in the first year, you're supposed to do a thorough scaling and root planning of multiple patients. Once you have done that, quota is over. So coming to the MDS in the Indian perspective, I know that there are certain guidelines laid by the DCI about what has to be done every year. So there's like a quota kind of a thing. So in the first year, I believe they're expected to do a lot of patients with scaling and root planing only. And once you finish the quota, then you can go into minor surgical procedures such as frenectomy, gingivectomy, which carries on to your second year. And then in your third year, you can do a lot of flap procedures. Now, this was what about probably about 10 years ago, but now I believe a lot of implant curriculum has also been added. So all the while you're also being trained in implantology during those 3 years. So I think, again, when I say that, what do we learn? These are kind of the overall view. Now, along with this, you also have to present journal clubs. There's a library dissertation and there's a thesis. So these are the things that will take up your time. Again, for people who keep asking me if they can, moonlight or do locum as a dentist somewhere while doing MDS, I think it's a bad idea. I mean, this takes up so much of your time because, again, you're doing so many things at the same time. So that is something that you don't have time or you won't find time to do anything else. So overall, these are the things that will be covered in your first 3 years. Now, one more thing that I usually tell people whom I mentor is the fact that the school or the college that you go to is not supposed to teach you everything. It is what you get from the school, as in what you want to learn. So the more you want to learn, the more cases you can do, the more things. So I think each of us who wants to do an MDS, and irrespective of the subject, has to have that drive to try and learn more as much as possible. So that is something that each person differs in. There are some people who will be like, no, I just want to do whatever the quota asks me to. And there are some others who are like, no, I want to learn more. So I think that latter aspect is very important. To have that drive while you're doing an MDS will take you forward, because again, remember, those are just 3 years of your entire career. So what lays that foundation in those 3 years is how many cases you do. And once you come out, you can then experiment and do a lot of things. Another thing that one of my professors in the school in US used to tell me was most of the cases there we used to do were called as MDP cases. They were called maximum resident benefit cases, MRP cases, where you could do a lot of stuff. And again, you could. So a lot of these cases are called as resident benefit cases, which means that you can do a lot of these procedures, try out a lot of procedures without fear, because there is a mentor or a faculty there to kind of back you up in case you do make some mistakes. So just do a lot of cases while you're in MDS. So that will kind of provide a strong base for you.
So, what foundational subjects or clinical skills a student should strengthen before joining the department, sir?
So when you talk about foundational subjects, now, if you think about it, periodontics of late, there has been a lot of studies about how our body in general is tied to the periodontal health. So periodontal or periodontitis is now known as the sixth complication of diabetes. So a good, strong foundation in basic sciences is very, very important when coming into the subject of periodontics. And that again holds true for all subjects, because there is a basic sciences exam when you do take your MDS exams. So basic sciences is very good. And as I mentioned earlier in the interview, good handling of oral surgery, where you learn how to reflect just a minimal flap before an extraction, how to suture, all of those. And of course, a good method of learning how to scale and root plane, holding the instrument properly, holding your curettes properly, holding your scalers properly. All of that will go a long way in ensuring that you have a seamless transition from BDS into MDS.
So, what's the difference in the exposure and patient load between the government and the private colleges? And do students in the private colleges miss out any hands-on experiences on complex or rare cases? So, do you have any advice for those who are choosing between the two?
See, again, when you talk about, of course, government colleges with their patient flow is always been pretty good, well established. There is a huge amount of patient flow. You get a varied amount of experiences. There are a lot of old private colleges which are also like that. I mean, in areas where there are no government colleges, an old private college probably takes the same amount of patients that a government college in any other place would do. So as far as trying to choose, again, asking an alumni or an alumnus of a college, somebody who has graduated, has been through the program, as to what their experience would certainly help a long way in making your decision. In terms of do students in private colleges miss out on the hands-on experience? I mean, see, a lot of private colleges nowadays take in a lot of PGs. Okay, so if you think about it, there are almost about six PGs in some colleges across India. So cases get divided. So if you do have a choice, then go for a place where there are less number of PGs, so that the cases are divided amongst the three of you rather than getting divided amongst the six of you. You get a lot more cases to work on. Again, so that I think would be the best way to choose a college. But in terms of asking the alumnus would be the best option, and trying to know who the faculty are and what the faculties bring in to that program. You don't want somebody who is very traditionally perio based, because then you're not learning too much about implantology. So that is something that where you want to choose a faculty who is overall knowledgeable about dentistry in particular, as to what is happening, because we, as an MDS periodontist, I would want the current resident to learn interdisciplinary dentistry. That has become the mantra for these days, is you cannot just focus yourself on knowing only about perio. You need to learn interdisciplinary dentistry. So I think choosing colleges where there is a good collaboration between two departments is also very important. So with these points, I think a good college can be chosen.
So, are there any fellowship necessary to do after the MDS in periodontics? And which fellowships do you actually recommend?
So when I talk about fellowships now, I was just talking about interdisciplinary dentistry, and this answer kind of piggybacks on that. Once a MDS periodontist opens a clinic, very rarely will he be doing only perio. He probably will end up doing a lot of other things as well. He's probably, because in India, the basis of a referral practice kind of is non-existent. I mean, nobody refers a case to a periodontist. They probably will have a periodontist coming in. So somebody, a freshly graduated MDS periodontist, will probably open a clinic and will do consulting for perio cases. Now, when he opens a clinic, he needs to do everything in his clinic. He probably will not be calling consultants because he also wants to do everything by himself. So if you talk about fellowships, I have known many MDS periodontists who graduate and do a lot of fellowships in, let's say, endodontics, orthodontics, other subjects, basically other subjects, to try and open a practice. Now, one of the main things that they would want to do with relation to perio slash, I would say, implants would be to learn the prosthetic aspect of it. Because many a times periodontists, while they're doing the MDS, will learn only about the placement of implants. They may not learn how to, give a good prosthesis, or what are the principles of prosthodontics when it comes to a full mouth implant rehabilitation. So those are the things that a fellowship would certainly help in. Other than that, again, there is learning keeps on going throughout life. So if not for a fellowship, you can attend conferences, you can attend hands-on courses, be it a soft tissue procedure, be it new materials that are available in periodontics or other subjects. So I think learning will continue throughout life.
So, in your view, what makes a periodontist truly stand out?
So the one thing in this current world or scenario that makes a periodontist truly stand out is, I think we are the last soldiers holding on to the tooth. We want to make sure that a tooth survives in the patient's mouth for as long as possible before we pluck it out and place an implant. There are dime a dozen people nowadays who are ready to extract teeth and place implants. But I think after a number of years of practice, of course, having been in practice for almost about 2 decades now, and having seen the cases that my father has treated in our practice, I can very well say that if you compare a tooth and an implant, you probably will get more life out of a tooth as long as the patient maintains it as compared to an implant. So I would want to prolong that tooth in the patient's mouth for as long as possible. And then when push comes to shove, extract it and then place an implant. So I think that is what makes us truly stand out, is that we try to save teeth as much as possible. Again, nothing beats a natural tooth when it comes in the patient's mouth as compared to anything else in the dentistry world.
Thank you so much, sir. All your knowledge and experiences with this interview was so beautiful. I'm pretty sure the students who would be hearing the interview, they will have definite clarity whether they want to go ahead with periodontics or not. Thank you so much, sir, for guiding us and sharing your knowledge and your experience of your life. Thank you, sir.